When we look at patients that have lumbo-pelvic hip problems and typically orthopedic diagnoses like iliotibial band friction syndrome, piriformis syndrome, knee pain, things of that nature due to overuse, and you mostly see this in people that do a lot of volume of work, and it can be in runners in particular. We want to do a program where we assess the patient until they get better, and sequencing of the exercise program is very, very important. We try to avoid just giving patients, go over in the corner and do 3 sets of 10, come back and see me, but you do ongoing evaluation. I want to point out something that we've seen with Elizabeth here. Elizabeth has had some lower extremity issues going on, and primarily through your left side?
Right side.
Right side. So this is really interesting when you look at somebody that has a lot of tightness. Basically, she's got positive Ober's, positive Thomas test, straight leg raise test on flexibility is a little tight. So let's watch her do a quadruped movement here. So go down hands and knees, just like you did earlier. If you want to turn around there for us. That's good. All right. So now what I'd like you to do is go through that movement that we're talking about. Now the first thing we want to do is set your abdominals about 20% of max. It takes 20% of abdominal or transverse abdominis contraction to engage that. So you want to make sure that the lordosis stays between L5 and L5, L1. So now start to move out of that movement pattern. So as we watch her do this motion, we're going to see a couple of things going on here. As she goes back and forth with the movement, there's very, very subtle motions here. So when she makes a right extension, there's a drop of the left pelvis, which means right multifidus cannot hold that side up. She also shows an increase in the rotation. So come back again. Watch the left side, okay? And then watch the right side. So you got a lot of rotation going on in this side over here. Come back. So then we would immediately stop that and we would go and stretch out the tight musculature. Okay, so come on back up. And then Jenny's going to do a stretching program here for her psoas muscles.
Just get like the very top of your and lie down. Oh, okay, let's do it. And then grab your right knee. It's not tight if it's all the way down there. Lift your foot up off the ground. Oh gosh, you might have to scoot back a little bit. There we go. That's better. Feel a stretch.
And then Jenny should internally rotate the femur. And then flex the knee. And then have the patient do an abdominal contraction. So if she sets her abdominals, she's going to inhibit her psoas muscle. And you would hold that stretch like you would any stretching program. And you would do that a few repetitions. And would stretch both sides. We want to make sure when she does the quadruped motion, then switch to the other side. And just for the purpose of filming, we're just going to go over some of the sequence for purpose of time of filming. But this could take a few minutes or 8 minutes in your Medicare patient, so you can charge 97110. Okay, so internally rotate, set the abdominals, come back over. Then you would have the patient come right back and get to the same hands and knees again. Same motion, okay? And you would watch to see, do they what? We stretch them in internal rotation, and she's got a lot better line of that, even with just doing 1 set. So that you can come back to the other side. So you would not just let somebody go do quadruped exercises if they're doing it with an overdominance of their psoas and their anterior tilt is increasing. You're only going to promote too much of the extrinsics and not enough of the intrinsic muscles. That's the whole point. Thanks.